right. Hello, everyone, and welcome back to the Push Podcast. My name's Sydney. I am a labor and delivery nurse and online educator in the birth and postpartum newborn world. And today I have a very special episode for you. I have a beautiful ray of sunshine guest for you, my very close friend, Kelsey. We met I would say, I think it was a couple years ago now, probably 2 years ago at actually a Tim Hortons event, I think was the first time we met and connected in person. But she is just, as I said before, a complete ray of sunshine. She is a body positive creator who recently welcomed her sweet baby boy into the world. And I wanted to have her on because she had a very positive induction story. And I thought we could talk about that today and dive into a little bit about her and her life and her social media journey. And yeah, so I'm so excited to have her on. But Kelsey, why don't you introduce yourself? Say hi to everyone who's listening on the podcast.
Hello, thank you so much for having me, Sydney. I'm so excited to be here. I
Of
am Kelsey
course.
McDonald for those that don't know me. I am a lifestyle creator. I post about self love, food, pets, and now motherhood. And yeah, I'm just
Mhm.
really excited to share my positive induction story with everybody.
Oh, it was like I following you throughout your journey of like pre-pregnancy to pregnancy to now becoming a mom. It's been so refreshing because I feel like you just approach it all with such a positive, like a positive demeanor and a positive light. And it's just, I don't know. I feel like there's so much. We were even talking before we started this podcast. We were talking about how there's so much misinformation online and so much fear mongering and all that kind of stuff. And I just feel like your account is the complete opposite of that.
Thank you. That means a lot to me. I feel like I'm a very cup half full person and I lead my life with
Yes.
positivity and it's always just brought really happy, good things into my life. And I know that you can lead a life of positivity and bad things still happen to you. Trust me, I'm very well aware of that. I just think
Yeah.
that if you can overcome and still try to be happy, like that's what life's all about. So if you come to my account, I
Yeah.
hope to make you smile.
Well, you definitely make me smile, so I'll
Oh my
tell you
God,
that.
thanks.
But tell us a little bit about why you started posting online. Like, what's your origin story? How did you start your social media accounts?
My social media account came about during COVID, obviously, as many of us did start. Um,
Mm-hmm.
but I started posting actually, it was a weight loss account, which obviously is not
Really?
who I am anymore. Yeah, so I was posting about like what I eat in a day and like a calorie deficit. It only
Mm-hmm.
lasted about a year. And then I made
Mm-hmm.
a video, which I call like my origin video of me saying, I'm
Mm-hmm.
done counting calories. I'm done talking
Yeah.
about dieting. It no longer feels right to me to be doing this. I feel like I just keep
Yeah.
going back to my eating disorder, which is binge eating. And it
Mm-hmm.
was just like a very hard time for me, I think, when I was just so stuck in that mindset and then posting on social media. But then I started posting self love right
Yeah.
after I came out of the whole weight loss aspect of it, right? So that's basically what happened.
Yeah.
I started as a weight loss account and then I decided that I didn't
Yeah.
love myself even though I'd lost weight. So I switched it to a self love account
Mm-hmm.
and I was
Mm-hmm.
learning to love myself at the same time I was posting about self love because I've always been a firm believer in I'm going to fake it till I make it. So I was really faking it
Yeah.
until I finally made it. And I
Yeah.
kind of just turned into my diary. And I was posting not only about
Yeah.
self love, but literally my entire life. And
Yeah.
I guess almost 4 years later, here we are. And I love myself fully. And it's been a really cool experience taking everybody along on that journey.
Yeah, and I think there's so much room online for body positive creators and creators who encourage, a healthy relationship with food and
Yeah.
with their body as we change and grow. And you have definitely done that. I know like you were definitely a safe space for me as I continued, my recovery from an eating disorder as well. And it's just, yeah, it's so refreshing. And I kind of want to dive in a little bit into how your relationship with your body and that whole framework that you developed and you worked so hard on, how did that change once you got pregnant?
So I was actually really nervous when I first found out I was pregnant because I
Mhm.
didn't know if the food noise was going to follow me. So
Mm-hmm.
before my loss last January, I guess, I
Yeah.
was in recovery for over a year. And then after the
Mm-hmm.
loss happened, I did relapse a little. And then I got
Yeah.
pregnant in April. So there was only like a 3, 4 month, sorry, there was only like a 3, 4 month period between
Period.
my
Yeah.
loss and my pregnancy. So
Yeah.
I was like, I'm stuck. I'm in a relapse right now. What do I do? And honestly, as
Yeah.
soon as I saw that positive sign,
Mm-hmm.
the food noise left. And I don't know if it was like a switch flipped in my head. I really
Mm-hmm.
didn't struggle with food noise. Maybe that's the first trimester nausea talking as well, that I wasn't that hungry.
True.
I
Oh
wasn't that hungry.
gosh. Yeah,
but
yeah, yeah.
but even during the second trimester, when I did get my appetite back, I really did not
Yeah.
struggle the way I've struggled in the past. So that was actually really
Mm.
cool, as somebody with an eating disorder, to see how, I guess,
Yeah.
motherhood changes your brain. And even now,
Yeah.
after having Max, I haven't struggled at all. I'm again now in
Wow.
recovery, which is amazing. I'm really grateful to be here again. Um,
Yeah.
and yeah, I'm proud of myself, and I'm proud of my recovery, and I'm proud of the mom that I am.
Yeah. You should be. You really should be. Like, you've done such an amazing job. And
Thank you.
I actually, like, from everyone I've talked to who have had histories with eating disorders and food noise and that kind of stuff, they actually say that during pregnancy and postpartum, there is something that switches in your brain where it's
100%.
like all of your efforts just are for your baby, you
And
know?
that's what I
Like
was
it's
going to say. I
just
think the thing that switches in your brain is that you're no longer doing it for yourself. Like any
yeah.
selfish bone I had in my body broke, like it
Yeah.
was gone. So
Yeah.
I was like,
Yeah.
if I binge, then I'm going to be hurting my baby. And this is not
Yeah.
good for my baby. This stress that I feel after a binge is not good for my baby. So
Yeah.
I just didn't
Yeah.
do it because I didn't want to go through everything else that would come after that. You know what I mean? And even now, postpartum, I'm like, I want to be an example for my son. And I don't want him
Yeah.
to have a bad relationship with food. So I need to have a healthy relationship with food. So that's why I've maintained my
Yeah.
recovery.
Yeah, exactly. Because those kids, they watch everything
They
and they
do.
copy everything that they see, right?
Yeah. And even though
So
he's so small, I feel like you're learning things every single day, and like you're watching me
every
still.
day.
Like your brain is literally
Yes.
developing in front of my eyes. So I need to be a good
Yes.
example.
Absolutely, absolutely. And you already are, and I'm sure you will continue to be, but I'm so proud of you. Just
Thank
want to say
you.
that. Like I'm so proud of you because I know how hard all these transitions can be and you've handled them with like so much grace. And yeah, I also want to know like what surprised you the most about pregnancy?
How much your body changes so quickly. Like
Mm, yeah.
honestly, the thing that surprised me the absolute most was how much it's okay. So this is obviously not going to be the same for everybody. This is very personal
Yeah.
to me and who I am. I thought that I was going to be
Yeah.
very sad with how my body changed, but I wasn't sad at all.
Mm,
And I wasn't upset about the weight gain at
mm,
all. Like I gained a significant amount of weight. I did. But I
yeah.
wasn't upset. I was
Yeah.
so
Yeah.
proud, and I was so just like amazed by what my body was doing and how it was changing. Like I had organs moving, like
Yeah.
everything was different about myself.
Yeah.
My hips were wider, like it was
Yeah.
just crazy. And I was just so amazed by the human
Yeah.
body. Like it was just an amazing
Yeah.
experience. I had a really good pregnancy though. So not everybody
Yeah.
has that experience, but it was just so cool
Yeah.
week by week to watch my bump grow and then the movement
Yeah.
happen. I feel
Yes.
like that was
Oh,
the craziest
yes.
part was baby moving. Like I loved it. I still get phantom pics
Yeah.
sometimes and I'm like, too soon. Um, and
Yeah.
so it was just really cool seeing what the woman's body is capable of. Unreal.
Yeah. Oh, I know. I'm one of those crazy people who's obsessed with it. I think
Yeah,
it's like the coolest thing on
you're gonna
planet
love
Earth.
it.
I'm
You're
like,
gonna love it then.
oh, I cannot wait. I cannot wait for
You
that
just feel
time of
so
my life to
strong.
experience it.
Yeah, you feel so
Yeah.
strong.
Yeah.
It's an incredible experience, and yeah, that's how I speak to it. Another thing that
Yep.
surprised me is how people treat you. I think like like
Mm,
not physical, so like On a different note, people treat you differently in a good way and also
Yeah.
in a not so good way. So like we lost a lot of people when I found out I was pregnant, but we also gained
Mm,
our circle and the people that are around us right now, which has been amazing. And also strangers,
yeah.
they just smile at you all the time.
Oh.
They're so nice.
Yeah.
Like I had a really good
Oh.
experience with so many like old ladies.
Yeah,
They're the
they just
sweetest.
love it. It's
Yeah,
just in them. Like it's innate. It's just like,
yeah,
oh, we need to protect her. We need to make sure she's doing okay. Like she's growing
100%.
a human. Oh, it's so sweet. That's
I
so
love
sweet. I
it.
know some people also feel like did you have any weird experiences where people were like touching your tummy if you didn't want them to, or
No,
was it pretty good?
I mostly offered for people to touch my belly. I know
Yeah,
some
yeah.
people hate it. I'm like, here, touch it.
Yeah.
Like, I'm like, this is so cool. I want you to feel it too. Like if baby was kicking. I
Oh
remember at
yeah.
my baby shower, I brought almost every single person to like this back hallway where we're in right now when baby was moving.
Yeah.
And I was like, here, feel him. Because I
Come
was just
feel.
so
Oh,
amazed
yeah.
by what my body was doing. So maybe the next pregnancy I'll be like, don't touch me because I already will have a toddler at that point who will
A
be
toddler. Yeah.
making me touched
True.
out. So we'll see. But this
That's
time
true.
around, I had no weirdos being like, let me touch your belly. Everybody was like, oh, are you sure? Like everyone asked for consent, which was really nice. Um,
Oh, that's good.
but yeah,
That's
no, I
good.
didn't have any like weird experiences at all. I'm very
That's
grateful
good.
for that.
That's amazing. And then I know you're a beautiful plus size girly, and during your pregnancy I'm wondering how were you treated by the medical staff, and how did you navigate being a plus size girl who's also navigating pregnancy and the healthcare system? Because I know there's so many people out there who have said, unfortunately, that they have been treated poorly or differently or in a
Yeah.
way that is not okay, and that
Yeah.
needs to change. So I'm curious how your experience was, and if you had to put in a lot of extra effort to advocate for yourself during that time.
I feel like this aspect of my pregnancy was probably the most frustrating. So my experience in the beginning was really good. It started off normal.
Mm-hmm.
And then
Mm-hmm.
obviously I gained weight. And I think at
Yeah.
my 25-week appointment, somewhere around there, I was
Mm-hmm.
told that I gained 20 pounds. And I was like, okay, like that sounded
Mm-hmm.
great. I was so proud of myself. It's like my
Yeah.
my mom gained like 80 pounds in pregnancy. So for me, 20
Yeah.
pounds, I'm like, I'm killing this thing. Like this is awesome. And
Yeah. Yeah.
the look on my face was excitement because
Yeah.
as somebody with an eating disorder who was no longer
Yep.
struggling with food noise and only dealing with this 20-pound weight gain, I was, like I
Yep.
said, I was happy. I was proud of myself. And my doctor kind of shut me down and was like, that's a lot of
Mm,
weight gain. And I was like,
mm,
oh, like brought me right down to earth in like
yeah.
a not
Yeah.
super kind way to the point where like I came home and I cried a little and my husband was mad at the doctor because
Yeah.
he's like, that weight gain isn't even bad. Like no weight gain in pregnancy is bad in my eyes. Like you're growing a whole human and every single body does that
Yeah.
differently. So to put somebody down,
Yeah.
especially a plus size woman, it just felt very targeted that way. And then
Yeah.
also, so I came into my OB plus size, as you know. I was
Mm-hmm.
already plus
Mm-hmm.
size. So I think at
Mm-hmm.
that point, I should have been told that the hospital that I was supposed to give birth at in my town wouldn't take if
Mm-hmm.
I went over a certain BMI. Medically, I understand. However, I think it's very outdated and they should um, update their hospital
Yeah.
so that they can take
Yeah.
people that are higher BMIs. But
For
I
sure.
was told at my 36-week appointment that I was no longer able to give birth at my hospital, which I've already toured, which I was already dead set on giving birth at. My world
Mm.
upside down. I had a full
Mm-hmm.
panic attack, which no pregnant woman should have to go through a panic attack at her doctor's office. You should be well informed of everything when you go
Absolutely.
in and not just brushed off.
Yeah.
So at 36 weeks, I had to transfer to a new hospital. At that point, my blood pressure was really high already. I had already gone to the hospital a bunch of times with it being elevated.
Mm-hmm.
And when I
Mm-hmm.
went to the new hospital, they told me that I should have been being seen 3 times a week at least. And
Mm-hmm.
the old OB was only seeing me once every 2 weeks. So there was a
Yeah.
lot of things that
Yeah.
could have went wrong because I wasn't properly looked after. And now looking
Yeah.
back, I'm like, I will never start there again. I'm going to just go to where obviously I had a really amazing birthing experience. But yeah,
Yeah.
it was a lot. I feel like I had to advocate for myself a lot more, especially towards
Yeah.
the end. Um,
Yeah.
there
Yeah.
was a time that I got sent to the hospital because my blood pressure was really high. It was like the first time it was high. And I was there from, I think, 7 o'clock till 4 in the morning. So I had no sleep. Like I
Wow.
was just exhausted. And the
Yeah.
on call doctor just wouldn't wake up and come in. So I have this really elevated blood pressure,
Yeah.
and they're telling me to go home and come back at 8 a.m., which is like 4 hours later. I'm like, could you not let me sleep here?
Yeah.
It's very
Yeah.
frustrating. And even when I told my OB that, she actually said, like, they should have let you sleep there. That was
Yeah.
ridiculous. So dealing with that was frustrating. And knowing what I know now, like going through
Yeah.
it, I would advocate for myself to just stay the night because coming
Yeah.
home the hour drive almost and then going
Yeah.
back 2 hours later didn't make any sense. But I feel like when you're a first time mom, a lot of things happen where you just don't know that it's not normal
Yeah.
or that you
Yeah.
can advocate for yourself. So knowing what I
Yeah.
know now, I
Yeah.
would definitely advocate harder for myself. Like my next child, watch out. I'm ready.
Oh my goodness. Well, I'm so sorry you had to go through that. I know, you were texting me a little bit here and there throughout that
FaceTiming
process,
you.
and yeah, literally, but it's hard cuz like not everyone even has access
Sydney.
to someone like, yeah,
Yeah.
literally. And I mean, you did the best you could with the information you had, and you were very well researched on your own as well, like not including me at all. Like
Yeah.
you were always, you did your research, you did what you could, and you still faced challenges. And I
Yeah.
think that's a problem in our healthcare system that
Yeah.
has nothing to do with you or any other mama out there who might be experiencing a similar situation. I think this is a system issue.
Yeah, definitely.
And I I truly like, that's why I want to have these conversations, is because we need more people talking openly about their experiences with it, so that hopefully it drives change in this area, because there's a lot of room for improvement.
Yeah.
And I know that, you going forward with your future pregnancies, you'll have that experience to advocate for yourself and to choose providers who
Yeah.
are familiar with um, patients who have a higher BMI or who
Yeah.
have a history of an eating disorder and all that kind of stuff. And I guess my advice for anyone listening who might be in a similar place and they don't even know how to start advocating for themselves would be um, to ask the questions, to ask if their providers have experience dealing with patients in this area. What would your advice be? I don't know if you have anything off the
I
top
do.
of your head.
Don't let people brush you off because, or don't let
Yeah.
the medical professionals brush you off because you're plus size. I feel like the reason that my OB was only seeing me once every 2 weeks instead of the 3 times a week they should have been seeing me is because
Yeah.
of my weight. And I feel like there's this correlation that weight equals high blood pressure. And that's not the
Yeah.
case. Pre pregnancy, my blood pressure
No.
was completely normal. And 2 months
Mhm.
postpartum, my blood pressure is completely normal. I don't have to take any blood pressure
Yes.
medication anymore. So I feel
Yep.
like there was this stigma that because I am a plus size woman, that my blood pressure was just
Mhm.
higher. But that's not the case. It was
Yes.
definitely pregnancy induced. And
Yeah.
the new OB saw that and actually did what she was supposed to do. And then I actually felt taken care of and safe. And I didn't feel that before.
Yeah.
So it was a blessing in
Yeah.
disguise to be switched at 36 weeks, but I wouldn't wish it on anybody because wow,
Well, it should have happened far
sooner.
sooner, for sure.
Exactly.
That still makes me angry, if
Yeah.
I'm being
I
honest.
went
But
1 pound over the BMI, 1 pound.
oh my goodness. Yeah.
And
No.
then I was
That
like, well,
should
I'm
have.
not going to lose weight. I still have 4 more weeks. So,
Yeah, yeah. And you bring up a really good point that there's a huge misconception that a higher BMI or being plus size equals having all of this list of like health concerns like high blood pressure and preeclampsia and high blood sugar. So having like gestational diabetes.
so many people thought I was
And
going to have gestational diabetes. I had people in my comments saying it, that I was going to
yep,
have it. And I was like, no, it actually does not. Like, it doesn't work like that. It could happen to literally
nope.
anybody despite your size. Like, it doesn't work like
Absolutely.
that.
And like, I'll say it here first. I have had so many patients who are potentially even underweight and have had high blood pressure or gestational diabetes. Like, it is not correlated. It is not the case.
No,
And I'm sorry you had to go through that through your comments, because it's just, I think people see that because when it's outside of pregnancy and you do have maybe like higher blood pressure or type 2 diabetes related to potentially like your diet or your genetic history and stuff like
yeah,
that, people think it's related. But with pregnancy, it's completely the placenta and the hormones that are released and all of that. So it's completely different. And I think people need to also stay in their lane and just relax, because it has nothing to do with them. Why are they so opinionated? But welcome to being a social media creator,
welcome
right?
to our life where
Yeah.
everyone's a doctor.
Yeah, honestly. Okay, so as you talk a little bit about your induction, after you switched OBs and you saw a specialist, how did that go? I know you obviously had an induction, and I do feel like you had a pretty positive induction once you were there. Tell
Absolutely.
me about it. Walk me through, your birth story. Walk me through
Okay.
how the induction started, what happened. I love hearing people's birth stories, and especially when they are positive, because there's so much fear surrounding induction. And I I know that there's so many scary stories online because people tend to focus on the negatives, which is true, but and it's still okay to talk about. I
So
mean, you can tell
valid.
me
Absolutely.
tell me your negative parts of your induction story, but
Yeah.
also just tell me everything. I want to know.
Yeah. I feel like sharing is so healing in every aspect, so the negative and the
Mhm.
positive, but you are right. You hear a lot more of the negative. So when I was researching inductions and trying to find other people's stories, I was
Yeah.
terrified. I was like, oh my gosh,
Yeah.
like, why do they want to do this to me? It's going to be horrible. But that's also
Mhm.
why I'm sitting here now and I want to share my story so that if you're listening and you're getting an induction, positive inductions do happen. And I am a success story of that. So I'll walk you
Yeah.
through kind of what happened from week 36 to week 38, which is when I gave birth. So the
Yeah.
first time I went to my OB, I actually met her at the hospital. She did an emergency meeting with me because she wanted me to feel safe and secure. And she knew how scary it
Oh.
must have been for me to have to switch so last minute. So I was at the hospital that
Yeah.
day. They ran every single test. Every single test. They started
Mm.
basically fresh. I got an ultrasound, all my blood taken, peed in a cup. I had
Yep.
the monitors on, everything. So I felt very taken care of that day. And there was
Yeah.
some protein in my urine. So at that point, we're like, okay. So
Mhm.
she sat down with me for like, I swear, half an hour. And she was busy all day doing C sections and helping people,
Yeah.
give birth to babies. So she sat
Yeah.
down with me though and treated me like a human for the first time in my
Mm.
experience because every other OB appointment was like 5 minutes. It was like, okay,
Yeah.
you're good, heartbeat, bye. So
Yep.
having her sit down and just talk to me like a person meant the world. And that's when we planned my
Yeah.
induction. So she told me that I was being recommended to be induced because of my high blood pressure, and we didn't want it to escalate to full blown preeclampsia.
Mhm.
Understandably so, I didn't want that either. I was very nervous. It just kept getting higher. And then I was in there
Yeah.
all the time because my blood pressure was so high and I had to just keep getting monitored. So it was a lot. And
Yeah.
she told me that 38 weeks, 5 days was when I was going to be induced as long as that was okay with me. And
Yeah.
that the baby was a good size to be induced and that everything kind of it made sense for me. Okay. So I did a lot of research. I
Yeah.
watched a lot of your videos as well. And I came to the conclusion that for my own health, I wanted this because my whole thing leading up to birth was healthy mom, healthy baby. And
Yeah.
my health was the one that wasn't doing the best. So it was time.
Yeah.
I agreed. And
Yeah.
then I went to my like appointments throughout the week. And then the day came. When I started my induction, they told me that it could take up to 3 days to even
Mhm.
feel contractions, anything, and that wouldn't even be a for sure thing. So when they checked me, they
Yeah.
gave me obviously when I got my cervix checked that day, they said
Yeah.
I was 0 centimeters dilated and not effaced at all. And it was hard.
Yeah.
So I was like, okay, they're like, we're gonna insert this Cervidil, but most likely this
Yeah.
is gonna take 3 days or more. So you're gonna
Yes.
go
Which
home.
is very common, especially for first time
Exactly.
mamas.
So common,
Mm-hmm.
so common. So that's what I
Mm-hmm.
thought though. I'm like, okay, this is gonna take 3 days. They insert it. I go home. I'm just relaxing because I'm like, I'm gonna be at the hospital the next day, 8 a.m. They're gonna check me again. If I need Cervidil again, I'm getting Cervidil again. Like I
Yeah.
gaslit myself so hard when I went into labor because I'm like, it should be 3 days. Like there is
Yeah.
no way that I am in labor right now. No way. So
Yeah.
I got the Cervidil at 7. They kept me at the
Yep.
hospital for an hour, obviously to monitor. Sorry, they kept me at the hospital for 2 hours to
Yep.
monitor me and baby and make sure that baby was tolerating the Cervidil.
Yep.
Everything was fine. I got home around 9 or 10 p.m. with Firehouse Subs. Don't judge. I was like, baby's coming out in the next few days anyway. So
Oh, no judgment. No
thank you.
judgment.
Thank you.
I
Uh,
actually just filmed an episode. Sorry to interrupt, but I just
no,
filmed
that's
an
fine.
episode with my cousin who's an OB, and she said that she also had sushi throughout her pregnancy. So I'm like, we did a whole nutrition episode where we like
Yeah.
break down like the risks and everything. So
Well, I
I
used to
think you're
post,
fine.
I was posting what I eat in a day while I was pregnant, and I stopped because I had people attacking me for eating my biggest craving, which is soft serve ice cream. And they're like, you're gonna get sick. And I'm like, if you think
Hmm.
I'm cutting out soft serve ice cream, you're wrong. You're wrong. I'm just
Yeah.
not gonna share it online anymore.
Yep.
So
Yep.
you take the risks.
Well, exactly. And honestly, I think you were fine to eat
Thank
soft
you.
serve
I
ice
was fine.
cream.
I never
So
got sick once.
there you
Live to
go. There
tell the
you go.
tale.
Okay, so you're at home, you got your Firehouse Subs, you're
Yeah.
feeling good, or are you starting to feel crampy,
So I
or
started
were
to
you?
feel a little crampy and I was like, what is this feeling? Because also when they inserted the Cervidil, I felt a cramp because I hurt. Like it didn't feel
Oh yeah.
comfortable how far they were up there. Okay.
Oh
It
yeah.
had been a
Yeah.
while. So I'm like, this was uncomfortable. Maybe I'm just feeling the pain from that check or like from getting that Cervidil. So,
Yeah.
anyways, I wait like an hour and they start happening a bit like one after another. And I'm like,
Yeah.
I wonder if these are contractions. I'm like, this
Yeah.
feels weird. So I'm in my head and I'm going, okay, it's 11 o'clock. I'm feeling a little rough. I'm gonna go sleep. I'm gonna go to sleep
Yeah.
and then it'll be the next
Yeah.
day. I
Yeah.
lay down and at that point the contractions really start and they're happening like
Mm,
every at that point it was every 7 to 12 minutes I was getting a contraction. So I'm like,
yeah.
they're kind of close, but they're still far enough. I don't have to worry. But in an
Yeah.
hour, like at 2 o'clock in the morning, they were every 2 minutes. They just
Oh my
switched like
goodness.
that. Like every 2 minutes, I was like, oh, this is bad. Like I didn't sleep from 11 till
So
2.
yeah, I was gonna say
I
you
was just
didn't get
breathing.
any sleep.
I was just breathing
Mm,
through it and going, okay, I'm going to try to sleep now. Because I was gaslighting
yeah.
myself. I'm like, there is no way that I am in labor
Yeah.
right now. There's no way. So
Yeah. You're
my
like, I can
husband,
potentially have a couple more days of this. Like, I need to
exactly.
sleep.
I got my husband to wrap his arms around me for like the counter pressure. And
Yep.
he was like, I was gripping his arm so hard that he's like, Kelsey, like you're in so much pain. Like we need to go to the hospital. You're in labor. I'm like, no, it's
Yeah.
not possible. I'm going at 8 a.m. He goes, time your contractions. So at that point, I finally timed them.
Yeah.
He was timing them for me, which is where I got like the 7 to 12 minutes because it was
Okay.
super random at that point. Um,
Yeah.
but when they were every 2 minutes, I'm like, they're not stopping. Like this is every 2 minutes I'm getting contraction and then it lingers and then it gets really big
Yeah.
again. So I'm like, I think
Yeah.
it's time to go to the hospital. So we go to the
Yeah.
hospital at like 3, and even they were like shocked. They're
Yeah.
like, it's not that they didn't believe me, but I think they
Yep.
weren't expecting me to come in so soon. So I was like, I
Yep.
think I'm having contractions. They hook me up. They can see the contractions. They know what's happening. It's
Yeah.
so late. She gives me this pain shot in my thigh. I don't remember the name of it, but it worked. It helped me. So
Yeah.
I get sent to the room. They put me in a room. I'm still thinking at 8 o'clock the OB is gonna come in and I'm just gonna get sent home. I'm thinking
Yeah.
this is gonna stop because I've heard of contractions starting and then
Yeah.
stopping. So
Yeah.
they never stop. Um, they were
Did
by
they, sorry, I was just
no,
going to
don't
say,
worry.
did they, when you got to the hospital, did they check your cervix right away and
No,
take out the Cervidil, or they just left
they
it
left it
in and
in. They
okay.
left it until
Okay.
4 in the morning. So at like
Okay.
4 in the morning, I had a nurse come in and go, okay, we're going to check you. At that point, I'd gotten a few hours of sleep, like 2 hours.
Okay. From the
At
medications and stuff.
exactly. But then the medication wore off and I was like, this
Yep.
is insane. And there was zero break at that point. Like I was having
Yeah.
contraction after contraction, no break in between. I was in the most pain I've
Yeah.
ever felt. I was like trying to walk and I couldn't walk. All I wanted was the epidural. I'm like, please,
Yeah.
God, give me the
Yeah.
epidural.
Yeah.
And so they came in at 4 anyways. They checked me and they're like, wow, you're 3. Like they took out the cervidil and then they checked me and they're
Wow.
like, you're 3, like almost 4 centimeters dilated. And I'm like, it
Yeah.
worked. And they're like,
Yeah.
do you want to bounce on a ball or take a bath? And I'm like, give me the epidural.
Yeah.
Yeah. I was like, I don't want to get out of bed at this point. Please give me the
Yep.
epidural. I'm in so much pain. And also, I
Yeah.
knew that if I didn't get it now, I wouldn't be able to sit still enough to get it because I was already like
Right.
just, and I just knew I needed it.
Yeah.
So they brought the anesthesiologist in to give me the epidural.
Yes. Yeah.
She gave me the epidural. It was the best experience of my life. It did not hurt at all because I was in so
That's
much
good.
pain. I just held on to
Yeah.
Cody and like held my breath and moaned. I'm a singer.
Yeah.
When I'm in pain, I sing.
Yeah.
It's like not songs, just there's noises coming out of me. So
Yeah.
I was
Yeah.
just getting through it. It's funny though too. We brought a bunch of like gift cards, Tim Hortons gift cards, $15 ones with chocolate.
Oh,
And
yeah.
after I got the epidural, I gave my anesthesiologist one saying like Merry Christmas. And she's like, do you
Yeah.
know in all of the years I've been working, no patient has ever given me a gift. And I'm like, well, you just
Oh.
literally took my pain away. You deserve all of them. I would give you all for
Yes.
but
Yeah.
that's just a little funny side story because she's never gotten a gift before, but she took my pain away. I'm
What?
like, this is the best experience ever. I was so
Uh-huh.
grateful. So after I got the
Uh-huh.
epidural, I was able to sleep a bit longer in between checks and whatnot. They
Nice.
actually, I think I only ended up getting 4 checks altogether. So I didn't need that
Oh.
many. I was laboring
Yep.
good. I wasn't like showing any signs of distress or anything. Baby wasn't.
Yeah.
So the next part that needed to happen was my water breaking, obviously. So before I got the epidural, they gave me the laughing gas, the nitrin, I think it's
Yes.
called, or nitrous,
Yes. Nitrous. Yeah. You
made
got it.
me so nauseous that I threw up. When I was
Yeah.
throwing up,
Yeah.
my water broke.
Oh my
I, I
gosh.
broke my own water. So I'm throwing up and I go, my water broke. They're like, you maybe just peed yourself. I'm like, no, my water broke.
Yeah.
Like I felt a pop.
Yeah.
And then she
You
checked me.
knew.
You broke your water. I'm like, you're welcome. Did you drown for you? It was funny because my body was just doing its thing at that point. Like I really was in
For
labor. I
sure.
think my body was ready no matter what. I think I
Yeah.
would have only, in my own brain, I would have only lasted another week anyways being pregnant because of
For
how well
sure.
everything went. It made me think baby's ready.
Yeah.
So
Yeah.
at 9 o'clock in the morning, the OB comes in and checks me. And at that point, I am 9 centimeters dilated. She goes,
Wow.
we're almost ready to push. Like you are just laboring so quickly. I'm like, this is awesome. So I send my
Yeah.
husband down to go get a tea. And I'm like, you have time. And then he comes
Yeah.
up. And then we did a little prank on him with the baby doll.
Oh
my
no,
nurses
you
my nurses gave me the fake doll and we pranked him that I gave birth. Um,
did. Oh my gosh.
I
That's
never ended
so
up posting it.
funny.
I took a video of it. I don't know why I
I
didn't
was
post it, but
gonna
it was pretty
say, I hadn't
hilarious.
seen this. You need to post
No,
this.
I know. It was hilarious though. Cody's like, what the hell? I'm like, gotcha. I was in
Oh
such a
my
good
goodness.
mood though. My spirits were so high. A, because I wasn't
Yeah.
really in pain. At that point, I started feeling contractions again because they're obviously winding down the epidural so that you can push.
Yeah. Yeah.
So I started feeling the contractions again. And at 10, they checked me. I was 10 centimeters dilated, literally at 10. And then they're like, okay, we're
Wow.
going to push soon. So just be prepared. And then my husband asked, oh, how long could this take? And they're like, hours. It could take
Yeah.
hours. She could be pushing for a very long time. So I'm
Yeah.
in my head just mentally preparing myself for this. They're like, let's do some
Yep.
practice pushes around 10:20. I'm like,
Yep.
okay. So I actually wanted to see myself labor. So they brought me that really big mirror and I got to see
Yes.
everything, which was
I love
really
that. I
cool.
love it. I love it. Yep.
If you're wondering if you're going to poop on the table, probably. Don't worry though. They're really quick. They're really quick. I pooped 3 times. Not once, not twice,
There
three
you
times.
go.
And I
Yep,
saw it all.
it happens.
Very humbling. I'm like looking
Hey, it
at my
means you're
husband like
pushing really well.
hilarious though. Very humbling experience.
Yeah.
So I'm pushing and I don't know, like I just felt so motivated and I felt so good because I wasn't tired and I was just pushing and I was doing like the
Yeah.
3 pushes and then taking a break and I could see everything. And as soon as I could see his little
Yeah.
head crowning, um, I was like, I just need to keep going. And it gave me all like
Yeah.
that push that I really needed. And so they
Yeah.
were like, stop, like we have to go get the OB. Like this is happening so quick. So I
Yeah.
ended
Yeah.
up giving birth in 24 minutes.
Oh my goodness.
It took 24 minutes from
Kelsey.
starting pushing to him coming out. So like they ran and got the OB because they were not expecting me to labor that quickly. This is my first baby. But I think I was
Yeah.
just like, I pushed, I was like, I saw his head and I was like, this is it. Like, I'm going to meet my son. This is
Yeah.
the coolest experience ever. Um, I had
Do you
Cody
think
holding up one leg and
the
my mom.
oh,
You're fine.
sorry. No, no, I was just going to say, do you think the mirror really helped you?
100%. I seeing what was actually happening down there gave me so
Yeah.
much like motivation and I was so excited and proud of myself and just like being able to
Yeah.
visualize what was going on,
Yep.
especially once you see the head. I feel like that was the biggest push factor for me. It was like,
Yes.
okay, he's literally right there, like so close. I can see him. And
Yeah.
that's when he started to crown is when they like told me to stop pushing for a second. They ran and got the OB, brought her back, and then she
Yes.
got in position. And then after
Yeah.
that, it was so quick. Like his head popped out and
Wow.
they were like, stop pushing. But I think I had the ejection reflex. I couldn't. Like I was just my body
Yes.
just he flew
Yeah.
he flew
Yeah.
out into this world.
Yeah.
Came out really
Yeah.
quick. But I think that the biggest part for me was in having such good birthing experience too was my support
Hmm.
system. I had my mom and I had my husband and they were both just like giving me so many positive affirmations the whole time. And like that might sound silly
Yeah.
to some people, but I feel like the
No.
nurses doing it, my husband doing it, my mom, it just made me feel like unstoppable. Like I could do anything
Yeah.
and that I was doing a good job. And it was just like the most beautiful
Yeah.
experience that I'll never forget. And I have it all on
Oh,
video, which is really cool to watch back. Like the minute,
yeah.
I think when I pushed Max out, my husband goes, that was so cool. Like on video, he's saying how cool it is that I
Oh,
did
I
that.
love
Like,
that.
and crying. Like, we're both obviously crying at that point. But yeah, like
Yeah.
I pushed him out in 24 minutes. He had a very quick descend into this world. And I
Wow.
ended up with minor tearing, not a lot though. Like I healed up within like
Okay.
2 weeks, which was nice. But I think
Good.
that was from pushing so hard. If I maybe took a little bit
Probably.
longer, I probably wouldn't have teared at all. But I was like,
Yeah.
I couldn't feel that part. That's the only downside of the epidural is you don't feel how hard you're pushing.
Yes.
So
Yeah.
there's like so many pros to it, but I'd say if I had to say a con of the epidural, it would be the fact that you can't feel yourself pushing down there, so you're more likely to tear because you just don't care.
Yes.
At
Yeah, you
that point,
have
I
a
wasn't
little bit
thinking.
less control. Yeah.
Yeah. And then I did
I
have to
I
take that blood thing. So I was bleeding a lot after, I think.
okay,
So
yeah.
they gave me
Yeah.
that pill like under my tongue
Under your tongue.
to
Yes.
stop the bleeding. I'm
It's
not sure what it's called, but I was
probably
too busy.
mesoprostol.
Yeah, I
Yeah.
think that's what it's called. I was too busy holding Max at that point. I'm like, I'll do anything. I'm happy.
You had Max to distract you from
Yeah,
anything that
exactly.
was happening. Yeah.
Yeah. I
And
was like, just don't
that's
let me
usually the
die.
case. Yeah.
They're like, no, it's not
So,
that bad.
oh,
Okay.
I love that you said that your support system was such a key part in
Yeah,
your birth story because I think, I always say that having a good support system is key for pregnancy, for birth, and for postpartum. And I
100%.
love that you had that because I think, like, even so, for most women who are giving birth, feeling safe is something that I think a lot of people don't have, especially being in the hospital.
Mhm.
It can be scary. Like it's an unfamiliar environment, and having your people with you so that you do feel safe and you feel a sense of security helps your body to relax so that you can actually deliver. Like a
100%.
lot of people, if they're scared, they can't.
I think
Mm-hmm.
stress and being afraid attribute to really
Yeah.
long labors. And because your body
100%.
is naturally really stressed out when your labor is
Yeah.
taking hours and hours and hours and you're so
Yep.
tired. So I think a lot of C-sections that happen are because your body just literally can't do it anymore. You're just so
Yep.
tired. So
Yeah.
I know some people don't like epidurals, but I'm just so grateful for mine because it was like
Yeah.
an energy saver. It literally saved all my
Yeah.
energy. So when it was time to push, which can take a long time for most first time moms, I
Yep.
was very
Yep.
lucky. And that's why like my story is so positive. And I know I'm lucky
Yeah.
because of how quick I labored, especially
Yeah.
being a first time mom. But if you can save your energy for the pushing part, I feel like that's a really
Yeah.
important part of labor. And that could just be from having really good breathing exercises and knowing your body and
Yeah.
going on the ball and going in the
Exactly.
bath and doing those things too. But for me
Yep.
personally, my pain level was just at a 20.
It was
I was
time,
ready.
and you,
It was
yeah,
time.
you were ready, and you listened
Yeah.
to your body. You
Yeah.
listened to that voice in your head that was like, "No, this is at a next level. We need to get the epidural."
Yeah.
And a lot of people who want to go unmedicated, and they're going for hours and hours and hours, and they're pushing their body beyond its limits. I sometimes come in and I'm like I don't necessarily like force them to choose anything, but I give them the opportunity to think about it, because sometimes having the epidural can actually, like you said, relax your body to the point where it can actually dilate and bring the baby down into the right position. Because when you've been laboring for hours and hours on end, and you're so tense and you're so stressed and you're in so much pain, sometimes your body just like can't dilate and it can't relax. And then once you get the epidural, it completely changes. So,
100%.
the epidural is villainized for so many reasons, but I think it can also be such a great tool in labor. And
Hmm.
like you said, there's pros and cons to having it. But I love hearing your kind of positive experience with it. And
Yeah.
going back, if you were to change anything, would you change something about your birth, or do you feel like it was exactly the way it was supposed to be?
I think both. I think it was exactly the way it was supposed to be. I wish I didn't gaslight myself for so long and I would have just went to the hospital when the contractions were five
Mm,
minutes apart rather than waiting till they were 2 minutes apart because the car ride there was scary, to say the least. It was snowing and I'm
yeah.
about a 40-minute drive from the hospital. So I was like, please God, don't let me give birth in this car. I was like, this is crazy
Yeah.
because
Yeah.
I have no idea.
Oh,
So
Canadian winters. Canadian winters. Oh my gosh.
awful. So I would have went to the hospital earlier, but everything else just happened exactly the way it was
Yeah.
supposed to. And I got the epidural when I was supposed to. I think I would
Yeah.
have waited a little bit and had a bath because the bath looked so good. It was a beautiful bath, and I was actually
Hmm.
wanting to use it, but I didn't get a break in between
Yeah.
contractions. And I feel like when that starts to happen, it was just like fight or flight.
Yeah.
I'm like, I need the epidural right now. If they were like maybe 5 minutes
100%.
apart, like if
Yeah.
I would have went earlier, I would have been able to use some of the more like
To use it. Yeah.
unmedicated what am I trying to say, Sydney? The more like the ball
Like
and the
the
bath.
the different pain management
Yes,
like
I would have
tools
been
that
able
are
to try
available.
different
Yeah.
pain management tools for sure had I not had contractions
Yeah.
back to back to back. You should have
Oh.
seen them on the monitor. It was like I'm like
Oh.
and seeing it after the
Oh
epidural, I'm
my
like, I can't feel
gosh.
that.
Isn't that a crazy thing how you're like,
Yeah.
okay, 2 seconds ago, I was really feeling those and I thought I was going to die. And
I was
then
gonna write a
you get the
will. I was
epidural and
like,
it's like,
yeah.
oh, yeah, literally.
I'm like telling Cody, I'm like, you have to stay at the house. I was like, if I go, you're
Yep.
living at the house with my parents.
That's how you know you were
Yeah.
in good, true labor.
Oh yeah.
Because when you start to feel like that, I'm like, okay, this is happening. This is for real.
100%. 100%. My husband's like, you're not
Oh my
going
gosh.
anywhere. I'm like, try
Yeah,
feeling what
yeah.
I'm feeling right now.
How was your how was your experience being, being a plus size girl in the hospital? Did you feel like the staff treated you differently, or did they treat you respectfully? How was that experience?
The staff at the hospital I gave birth at were the most incredible group of women that I've ever encountered in my
Oh,
life. I had all girls, and it's actually funny. The first time
girl
I went to the
power.
hospital, I had mentioned that I was an influencer, and so I think they looked me up
Mm-hmm.
because, well, when I went in for my labor,
Oh,
they're like, "We know you. Like, we watch your videos online."
yeah.
Like, one of my nurses
Aw,
had already
that's so
followed me on
sweet.
Instagram, which was really cool. So, like, they had those few weeks
Oh,
to actually like get to know me a little bit before I gave birth there. And the nurse that I had
yeah.
that day was actually the nurse that triaged me that first day. So I already like knew somebody.
Mm,
And she was such a
yeah.
sweetheart. And the other girl I had was such a sweetheart too. So yeah, the only regret I have actually is not taking a picture
Yeah.
with my nurses or getting a picture of them with the baby.
Oh,
I was just
yeah.
not
Yeah.
there anymore after I gave birth. I was just so like focused on Max that I didn't even think
Oh, for
about it.
sure.
The
Yeah.
content creator in me was like, goodbye. But
Yeah.
no,
Yeah. Yeah.
I
Yeah.
wish just for memory's sake, not even for content. I just wish I could have had that because they were such an incredible part of my
Oh.
birthing experience. They were amazing. And I was also
Oh,
telling them all about you, by the way. Any
really?
medical profession knows Sydney. I'm like, I have a friend
Oh
who's a
my
labor and delivery
gosh.
nurse. I'm like, she's
Oh,
a cool
you're so
influencer.
sweet. You're
Because
so sweet. I love it.
you're just so smart and well spoken, and I feel like you make
Oh,
so many people feel safe and secure, and like it's just
yeah.
been really cool not only having you as a friend but having you as a source to like look up
Yeah.
online. Like if I'm going to
Yeah.
trust anybody's opinion, it's Nurse Sydney's. So
Oh,
I'm
you're
just
so
grateful for
sweet.
you.
Thank you. I'm so happy that, even though I wasn't able to be there for you, even though I literally I would have. If I was in
Next
Toronto, I
time.
would have been there. But I'm glad you had providers and nurses who still gave you that same amount of like feeling of safety and
Absolutely.
support that you needed, because that's the most
Absolutely.
important thing. And I think there are really, really amazing nurses and providers out there. I think we hear of the ones that maybe need to retire or should have chosen a different profession. We hear
Right?
about those stories, but there are also some really fantastic ones. And I'm so happy that you were
Yeah,
blessed with those people in your birth and in your delivery. um
absolutely.
and kind of changing gears a little bit to your postpartum experience. How was that? Like, how was that shift from being pregnant and having a somewhat pretty good experience with delivery, and then suddenly becoming a mom? Like, how was
Well,
that experience?
you know what humbles you the most when your pain medication after you give birth is two Advils and two Tylenols, and you're like, for the
Mm-hmm.
pain I'm feeling, that's all I get. So,
Girl, I know.
yeah, that
Yeah.
sucked. That was the most bring you back to earth moment. I'm like, that is the pain management I get for how I'm
Yep.
feeling right now after like the most painful experience of my life. Because at that point, all of the epidurals wearing out, except for my one leg. It was numb
We're
for a
off.
little
Yeah.
bit. um, oh my gosh.
Yeah.
I have a horror story. Be so careful with your catheter after you have an epidural because I just kicked my leg out and I
Mm.
ripped it out of me. And it was like just like in a little
You
bit.
did?
It was so painful.
What?
That was probably more painful than childbirth. It hurts so
I
bad.
have never had a patient do that before. That's
It's possible.
crazy.
It's possible and it happened to me and it hurt so bad. I'm like, I think I kicked my
Oh,
catheter out. They're like, no way. And they look, they're like, it was literally dangling by a thread. I'm like, I felt it. Like,
you're like,
I'm
yeah, I know I did.
my
Oh,
legs were still sort of numb. So like when I was like moving, I'm also plus size. I'm like, not a lot of room in that bed. I'm like,
yeah.
it was very
Oh,
painful to
yeah.
say the
The
least.
beds are tiny. The
Yeah.
beds are not
So
comfy.
also hospitals are so hot.
Oh,
They're so hot in hospitals. I don't know if it
yes.
was just me, but I was sweating.
Yeah.
Another
Yeah.
thing postpartum, like right after, is you've gotten no
Yeah.
sleep since you've like got up and started pushing. Like I was maybe running on 3 hours of sleep, like full sleep. Um,
Yeah.
so after you have the
Yeah.
baby, it's like your mom, your baby wants to eat every
Yeah.
2 hours, has to eat actually every 2 hours. So
Yeah.
you're not sleeping. So like, yes, you
Yeah.
have that adrenaline, but like come 4 in the morning, you're exhausted.
Yeah.
You're exhausted. And we actually had
Oh,
one negative thing happen after the fact. It was around 7 o'clock
yeah.
at night, and we had just put Max in the bassinet, and I was going to take a nap. And he turned and looked at me, and I thought he was having a seizure. It terrified me. So I call my nurses. I'm like, my
Oh,
son's having a
yeah.
seizure because he started like convulsing a little. I had no idea that he
Yeah.
was choking on his amniotic
Yeah.
fluid, but they come in and like a group of
Oh
nurses come in
no.
within 30 seconds, grab him, put him down and start smacking him on the
Yeah.
back, obviously. And then I see fluid come out and then they
Yeah.
take the little suction tube, they put that down his throat. I'm like
Yeah.
disassociated, but watching and like in pure
Yeah.
panic, but like there's nothing coming out of my mouth. I literally felt like an out of
Yeah.
body experience because I think it was the
Yeah.
first time in my life I felt so utterly terrified because like my heart
Yeah.
was now outside of
Yeah.
my body. And it was the first time that like I
Yeah.
didn't know what to do. So he was fine.
Yeah.
They said that because I gave birth so quickly, he probably ingested a lot of
Mm-hmm.
still had a lot of the amniotic fluid or ingested the amniotic fluid, but I didn't even know that was a thing. I had
Yes.
no idea. So I'm sharing that not to scare you, but to
It
tell you if you
is.
give birth really quick, it's a possibility. And if they look like they're seizing, it's
Yeah.
probably not a seizure. It's probably them choking. So at that point, call your
Choking.
nurses and
Mm-hmm.
start patting them on the back. But that was really
I
scary.
always say I always say it's like the baby doesn't get as good of a squeeze in a way,
Yeah.
a
Yeah.
squeeze on the way out because their lungs are filled with fluid like while they're
Absolutely.
inside. And then kind of once they take that first breath, it fills with air. But sometimes if they don't get that good squeeze to get all that fluid out, they
It's
can
there
they can
still.
inhale a lot of it. And
Exactly.
yeah,
That was
yeah.
scary though. Oh my.
So
And
you're
I'm like, what if
exactly
I was
right.
sleeping?
That's what was so
So no one slept
yeah,
that night. We
it's
took
scary.
turns. My mom and Cody stayed in
Yeah,
the room with me,
watching him.
and then no one slept. And then for the
Yeah.
first 3 days after I came home, me and Cody took turns sleeping because we were so traumatized by that. And I was like, could this happen again? They're
Yes.
like,
Yeah.
we can't say no. Like it could happen again. So I'm like, well, no one's sleeping until I know that he's not going to choke on his amniotic
Yeah.
fluid.
Yeah.
So super scary. But
I
postpartum
know.
for
Oh,
me was obviously
I'm so
it,
sorry.
that was like my negative experience coming into it. But I think that is kind of normal too. Like if it wasn't that, I was going to watch for his breathing anyways for the first few
For
days
sure.
because you just get so in your head and
Oh, yeah.
you love them so much and they're so new to
Yeah.
the world and they're just learning how to breathe and they're learning that they're not in your body anymore. And that takes a really long time, right? So
Yeah.
the only other thing
Yeah.
that absolutely was horrible postpartum was the first poop. They don't warn you
Oh,
about
no,
that.
the first
It
poop.
was so awful. I was
Yeah.
crying. I was bawling my eyes out on
Oh,
the toilet. Awful
oh my
experience.
gosh.
Don't mean to scare you, but good luck.
Did they give you did they give you it? Did you take any stool softeners or
Nope.
anything? Or
Nope.
did they
They
just
didn't
raw dog
offer
it? You
it.
just,
They
yeah.
raw they raw dog me. I took
Oh,
Restorelax once I got home. I was like, I'm never experiencing
smart.
that
Very
again.
smart.
The poops hurt for like 2
Yep.
weeks though.
Yep.
Like, no joke. I was
Yeah.
like,
Yeah.
I came home, had my first like postpartum shower. I couldn't do it alone. Like I know some people like have that independent
Yep.
moment. I was like, Cody, can you please sponge bath me?
Help
Like
me.
he came in the shower
Yep.
with like not with me,
Yep.
but like was outside the shower and like helping me wash myself and
Yeah.
everything. And it was just like me bawling my eyes out. I feel like it was the
Oh.
first time I like really let myself decompress. And for me, decompressing is bawling
Yep.
my eyes out. And so during that first postpartum
Yep.
shower, I just cried and was just also very thankful in
Cried.
that moment
Yeah.
for my husband because he was there literally washing me and like
Yes.
putting creams on me and like
Yeah.
he peri bottled me for the first like 3 days of coming home. He
Oh.
used the peri bottle on me and came into the bathroom with me every single time to make sure I was okay. And like I was scared to look downstairs because I was
Yeah.
like, what does it look like I don't want to look. And he like went
Yeah.
down there
Yeah.
and he was looking and he's like, babe, it's not that bad. So he gave me this like confidence to look at it and I was like,
Yeah.
like it's so swollen. Because there's just so many
Oh.
changes so quickly. Like your
Yep.
life literally changes overnight. Like
Yeah. It really
different
does.
person. In less than 24
Oh,
hours, I became somebody's mom. So lots of things. I don't mean to
wild.
scare anybody, but those are like the raw realities of how you're going to feel the first few
No.
weeks. And then it gets better.
Yeah.
Then it gets
Yeah.
better and you can walk better. You're going to feel a little overwhelmed by the fact that you
Yeah.
can't do everything you want to do. But
Yeah.
now 2 months out, I'm so just like myself again a little bit. Like I've gotten my spark back pretty early on and I definitely
Yeah.
attribute that to my support system because I have Cody and I have
Yeah.
my mom. For
Yeah.
those that don't know,
Yeah.
I bought a lake house with my parents. So I actually like have them 24/7, which is rare and beautiful and the best
Yeah.
decision I've ever made in my entire life. So I'm
Oh,
very lucky that way to
so
have
good.
the like literal
Yeah.
in-house grandma who raised me and did a damn good job at it. So I very much trust her with my baby.
Y-
Um,
your mom is the sweetest person
yeah,
on planet Earth. I
she is.
love
She's an
her so
angel.
much. She really is. She really is. And I'm so happy you had that
Yeah.
support and you continue to have that support
Yeah.
because, it's so important postpartum. And you're
I've
right.
said it. I've said it so many times that if I didn't have the support system I have, I can see how easy it would be to get postpartum depression. Because when your
Yeah.
hormones are dropping, I am
Yeah.
such a happy person, Sydney, and I had gray days, I called them. I called them my cloudy days
Yeah.
because I could feel my hormones shifting and it
Oh,
made me
yeah.
sad. And I also had
Yeah.
milk ejection reflux. I think it's called,
Yes.
you know what I'm talking about.
I think it's
Um,
Dimer,
yeah,
Dimer.
yeah, I
Dimer?
had
I don't
that
know.
and I would get
Yeah.
severe anxiety during my letdowns. I'm
Yes.
I'm way better now. It only happens occasionally
Good.
when I'm pumping, but never when I'm
Yep.
breastfeeding. But in the beginning, it was every time I'd have a letdown, I was having this
Good.
severe
Oh,
anxiety. And I was like, what is this? Am I not normal? Am I having postpartum anxiety? Am I having depression? Like I would get these thoughts and then I just looked it
yep.
up and I was like, that makes sense because I was like, I am
Yeah.
feeling anxiety every time I breastfeed, but it was only when
Yep.
I breastfed or like when I would pump. And it's so
I'm
normal
so
and not talked
happy
about a
you bring
lot.
that up. Yeah, I'm so happy you bring that up because it's something as a labor and delivery nurse, I learned through social media
Yeah.
that was a
Wow.
thing, which is crazy. Like that should be something that we are taught and it wasn't.
Yeah.
And I just yeah, I'm so happy
Because
you
you
brought
think
that up.
something's wrong with you. Because I'm like, I'm supposed to be
Mhm.
bonding with the baby right now. Why am I feeling so
Mhm.
anxious when he's breastfeeding? Like, I want to breastfeed.
Yep.
So I think a
Yep.
lot of the time people just stop breastfeeding because they don't
Yep.
want to feel like that. They think something's wrong with them because you can not just have anxiety, you can have suicidal ideation when it's happening. You can have um, severe sadness,
Yep.
anxiety. There's a
Yep.
whole plethora of things that can happen while you're having
Yeah.
that reflux. So everybody
Yeah.
feels it differently or not at all.
Yeah. Yeah. It's honestly postpartum is such a wild ride. Like
Yeah.
the arguably the biggest shift in hormones you'll have in your
Hmm.
entire life. And you're so right when you say like having a good cry, like having a good shower cry, there's just nothing like it,
There's
you
nothing
know?
like a shower cry.
Yeah,
It
truly.
feels good.
It feels good. It's good and it's okay to cry. Like it's okay to feel all those
It's so normal.
emotions.
Feel them. You have to
Yeah.
feel them because
Yeah.
being like postpartum can feel so lonely, but you have to remember you are not alone. So
Yeah.
many women before you have felt this or at the
Yep.
exact same time are feeling this way. But you're
Yes.
going to have this
Yeah.
mom guilt no matter what, I think, when you're feeling it, that you're supposed to be so happy because your baby's okay and your baby's healthy. But like you're allowed to
Yeah.
feel your feelings and be sad and grieve who you used to be and feel the
Yeah.
hormones that are literally coursing through your veins because you just did the most taxing thing you'll probably ever do in your entire life.
Yeah.
Pregnancy,
Yeah.
childbirth, your whole life switched within 24 hours to a completely new life. So feel
Oh
those
yeah.
feelings. You'll be better off for it than just like holding it down. Because I feel like when you hold back your emotions and you don't actually feel them, they build up and they create an even
Yep.
bigger feeling that you might not want to have to get to. Like I feel like if I wasn't feeling my feelings and talking them out with my
Yep.
support people, my husband and my mom, I would have
Yep.
very easily gotten depressed because there were days where I would
Yeah.
just tell Cody, like, I'm having a sad day. I'm not having any negative thoughts with it, but I'm definitely feeling down today.
Down.
Like,
Yep.
it's so
Yep.
normal. And you have to talk it out. You have to tell people because if you just keep it in, then you're going to feel
Yep.
even more lonely.
Yeah. You have to verbalize it and you don't want it to build up into the point where then it eventually explodes, right? So
Absolutely.
I hear you. That's really good advice. Um, Last question for like postpartum I have for you is how are you feeling in your body postpartum? How like do you look at your body and you're like, it is so amazing. I did that damn thing. Or or are you feeling like this is really different, and I don't know if I like it or not.
I feel like a solid mix of both. Like I did the damn thing and I'm so proud of my body. I think the only thing
Yeah.
that upset me was like so much of my clothes didn't fit and or
Mm.
so many of my clothes. Is that English? So much of my clothes.
So I know what you
Mom brain.
mean.
Thank you. So much of my clothes did not fit me and that was affecting
Yeah.
me because I was wearing like these Grammy pajamas, I call them. They're like button
Yeah.
up nightgowns and I'm like I don't feel
Nightgowns.
like myself. I was like I feel like an
Yeah.
80-year-old. I need clothes. So for my birthday,
Yeah.
I just spent a ridiculous amount of money. I don't want to talk about it on clothes, but
Yeah.
it was
Yeah.
so good for my mental health. I feel amazing. I got these overalls. I
They're
love
so
them.
cute.
I feel
You
like a
look
real
amazing
mom
in them.
now. Thank you. But
I
yeah,
was
like
literally texting her that she influenced me. I need to go get overalls like right
you
now. I'm
do
going to go to Old Navy after this.
you absolutely should. You look so cute in overalls. But yeah, like I'm so proud of my body. As for like changes, my hips are wider. I've definitely noticed
Yep.
that. My boobs are bigger, obviously, because I'm breastfeeding and they're filled with
Yeah.
milk. Um,
Yeah.
my stretch marks, I've always had stretch marks. But I
Yeah.
because I'm plus size, I feel like the baby kind of just like grew the already belly out. And then
Yeah. 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 Yeah.
postpartum, it's just kind of gone back in. Like
Yep.
it's the only thing that looks visibly different is like where my belly button piercing is stretched a little bit, and then I have more stretch marks up
Yes.
higher on my stomach. But
Yeah.
I'm not mad about that at all. I had so many people saying,
Yeah.
"Oh, are you so worried about the stretch marks?" I'm like, I've had stretch marks since grade 6.
Yes.
I'm
Yeah.
not worried. I've had a long time to come to terms with my stretch marks,
Yep.
and they're a
Yep.
reminder that my body did just the most spectacular thing ever. So I'm feeling
Yeah.
really good in
Yeah.
my postpartum body. I think that, as you know, Canadian winters suck, and having a baby in the
Yes.
winter has been such a blessing
It's hard.
because it's
Oh, I
reminded
was
me to
going to
slow
say,
down. Wait for
I
it,
was going
and
to
a
say it's
curse.
hard.
No, it's been a curse too. It's been a blessing in the way that I've been
Okay.
able to slow down and really just like spend time at home and
True.
like have the excuse that I
True.
don't want baby to get sick, which is not an excuse, it's reality, but
Yes.
it's a
Yeah.
good way to be able to stay home. But it's
Yes.
also been a curse because I
Hibernate
want to
a
go
little
outside.
bit.
I miss the sun. I miss
Yeah.
heat. I miss walking. I
Yeah.
feel like I'm so stuck in the house, and like the only time I leave the house is to
Yeah.
go grocery shopping. And in the beginning, I left the house twice and got sick. So I
Yeah.
was so
Yeah.
mad, and I was like, "Okay, I'm just not gonna. I don't want to leave the house because I had a really bad cold. Then I was stressed out about getting Max sick, and he never got sick, thank goodness. But I can't
Yeah.
wait for
Yeah.
spring and just to like get outside and go for walks. And we went for one on the
Oh,
weekend because like
yeah.
where my house is, our street right now is an ice rink till you get to the main road. So I like took the risk on Saturday because my husband was
Yeah.
there and I was like, if you fall, like you're gonna take the fall and like I'll chase the stroller. Worst comes to
Yeah.
worst.
Yeah. Yeah. Oh my
I told him
gosh.
to walk really slow. I was like, please don't let
Yeah.
anything bad
Yeah.
happen. But we got off our
Yeah.
street
Yeah.
and then we went for our walk and it was just so nice to be outside and Max loved it too. But
Mm.
I'm not doing that by myself because it's a literal ice rink and I have 2 left feet. So I'm not
Uh,
risking it. So as soon
you
as
need
it
to
melts
get
out here,
my mom has these like things that she puts on the bottom of her boots that are like pointy. I don't know. It helps with walking in ice. You
tell
need
her to
that.
send them to me. I need that.
Yes, you
Absolutely,
need
yes.
that.
Because my like Uggs do not have a good sole on them
Oh
at
gosh,
all.
you're doing it in Uggs, Kelsey.
The time that we hung out in Toronto, I wore white cowgirl boots that had zero tread on the bottom of them, like
Oh my
absolutely
gosh,
none.
you're right.
And
I
I
remember
fell.
that.
I came out of the
Yeah,
car in Toronto, stepped
yeah.
into a snowbank, and fell so hard the taxi driver saw my butt behind me. Cody like pulled
I
up, stopped
remember that.
traffic to make sure I was okay. And I was just so proud of
Yep.
myself for not crying because I didn't want to ruin my
Yep.
makeup. And then I
I
told Sydney,
remember that. I remember you telling me that. And then
yeah,
after the event, I like walked you to the car, remember?
you like held my hand. You were like, you're not falling again. Like I have
Yeah.
such bad shoe choices. Like I'm not a good chooser of shoes. Chooser of shoes. Yeah,
Yeah.
that's not me. Really bad. But
Oh
my
my
feet did go
goodness.
back to normal. Remember when I told you they went up like 2 sizes? They're
Yeah.
right back to normal now. The
Okay,
swelling's
good.
all
So
gone. They
you
didn't move
can
up a
fit into
size.
all your shoes. Oh my
Thank
gosh.
goodness. Because I'm already a size 11. I was like, if I'm a size 13 now, I'm just like, it's over for me. I'm only wearing
It's
men's shoes
over.
for the rest of my life.
Yeah, yeah, yeah.
So
Oh
very
my
grateful for
gosh.
that. If you have had really bad swelling in pregnancy and so many people have told you that your feet are going to grow and that you'll never fit into your pre-pregnancy shoes, that could be true, but it also could be wrong. So
Yeah.
let's go with it.
Yeah.
Could be wrong because my feet went back to normal.
Oh my gosh. Okay, well that is good. That is good to know. There's hope. There is hope
There's
that
hope.
you will fit into your your shoes.
Success story.
Well, Kelsey, this has been amazing. I want to thank you so much for coming on the Push podcast and
Thank you for
being so
having me.
vulnerable and open because it's hard to talk about these things and you I know are helping so many other mamas out there and other women who might be going through similar struggles that you have gone through and yeah, I can't thank you enough. And I want to know like where can people find you? Tell the listeners where they can find you online.
Well, thank you so much for having me, and thank you for all those really kind compliments. You are literally also a ray of sunshine. And if you want to find
Oh,
me and have me put a smile on your face, you can find me on Instagram at Kel McDonald, and you can find me on TikTok at Kelsey's Life in TikToks.
oh, I love it. Okay, make sure you go give her a follow. She trust me, she is amazing to have on your feed. Like you're one of like the first circles that pops up on my Instagram stories because I guess I watch all of your stories, but
Same
it's
goes
just
for
because
you.
they always make me feel good. So I'm like, I need to watch her. But thank you again. And this is, you know, a sign for everyone that birth is not one size fits all. And, you know, neither are our bodies. Our bodies are all
Absolutely.
different. And that's what makes them beautiful. And, you know, positive induction stories also exist. You are clear representation of that. And I really appreciate you sharing that story so openly. So thank you again
Thank you,
and
Sydney.
bye, everyone.